Hello everybody, John Ashworth here, coming to you again from the virtual coaching studio. We're improving upon the backdrop in this studio, one day, 1 week at a time, so tune in regularly to see how that evolves. Today, this is a follow-up to my segment last night on NBC 15, usually with Lee Mills, last night with John Stofflet. Lee was out, and we were talking about pregnancy and exercise, and one of the things that we did not have time to cover is back pain during pregnancy, which I know a lot of women experience back pain during pregnancy, of course, as your belly gets bigger and bigger and that fetus develops. That is tugging on your posture, bringing you more and more into that lordotic curve in your low back, and that can create some real havoc along with a variety of other things. In addition to that, don't tune this out if you're not pregnant or if you are a male, because most of these tips still apply to the rest of us. So we're going to go through them one by one. I'm going to stand up and demonstrate some things from time to time, and I'm going to pull that up from time to time. Well, no, I'm not. I'm trying to get a preview. Anyway, here we go. Back pain during pregnancy. This article in particular is right out of the Mayo Clinic. And just as a side note, I have come to love Google Chrome as a browser. And one of the things that I am really loving is the combination of Google Chrome and Evernote. Evernote is a note-taking system that synchronizes notes on all computers, allows you to capture all the information that we are all consuming every day. And one of the add-ons for Chrome is this little light up here that's in the screen, right? Let me make sure that's in the screen. This little lamp-looking thing up here is called Clearly, just like it sounds. And what that does is it takes any website and makes it more readable immediately. So if I click back, this is the website that this article is coming from. You never know what kind of tips you're going to get here at the virtual coaching desk. So here's the article, pregnancy and exercise article. But if we hit Clearly, it just takes all the excess away and allows us to clearly see what we're looking at and read through it. The other thing that's cool about Evernote is as you begin to collect information, is Evernote will then tell you, well, what are the related notes that I have inside the system? And here they are, back pain during pregnancy. That's the article I'm looking at. But here's 5 elements of Qi running from active.com. Qi running is a concept that is very postural oriented, if you can say it that way. And so it's really nice over time as you collect information, you end up with a lot of good resources. So here we go. The very first thing you need to do is practice good posture. Stand up straight and tall, hold your chest nice and high, keep your shoulders and your back relaxed, and don't lock your knees. The don't lock your knees is a key one. I work on this a lot with clients while they're lifting. A slight bend in your knees while you are standing actually makes you more powerful, makes you stronger. It kind of coils the muscles a little bit. It makes you stronger. So prevent from locking those knees. But the main thing is ears in line with your shoulders, in line with your hips, in line with your ankles, and not getting stuck in positions during the day where you're slouching in your chair or slouching when you're standing. That stuff definitely takes its toll. Number 2, get the right gear. Good shoes. By the time most people show up as a client in my studio, their shoes are terrible. They've been walking around with these terrible shoes for a long period of time. Also, if you're pregnant, consider wearing a maternity support belt. Although the research of the effectiveness of these belts is limited, some women find the additional support helpful. So again, very, very individual. Number 3, lift properly. This is a big one. You want to use your legs when you lift. And this is a discipline that everyone needs to build in their life because it's so easy to just, if something drops on the floor, it's just quick and easy. You bend over, you pick it up. But if I actually get down, like the true Bohemian athlete, get my back in a good position and come up, it's so much easier on my back, and you will develop good leg strength along the way as well. Sleep on your side, not on your back. Keep one or both knees bent. Consider using pregnancy or support pillows between your bent knees, under your abdomen, and behind your back. Personally, I sleep on my back. I know that a lot of people don't like to sleep on their back, but I always elevate my legs because that puts your back in a better position. It's the same thing when you turn on your side. A pillow between your legs makes a huge difference and takes a lot of the pressure off of your back. Okay, so now just briefly here, we're going to flip back to the article itself, which I'll provide a link to so you can actually go and read this article in addition to listening to me. I'm trying to keep my explanation brief here. Number 5, so here we hit Clearly, And boom, it's like magic. Try heat, cold, or massage. Number 5. Heat, cold, or massage. Hot, ice pack, hot pack. People often ask me what's the difference, which one is better. A lot of times it really comes down to what feels better to you. The general rule is when in a more acute situation, like in an acute injury, you just hurt yourself, ice is better. It's going to kill the inflammation and get rid of some of the pain and help you feel better. But when you're pregnant and you're dealing with this on an ongoing basis and the muscles are getting tight, because when that back goes into a curve, all the muscles are trying to compensate and pull and they get tight. Sometimes a heat pack works better. And I'm also going to provide a link to the last video that I put into the system, which are these simple stretching moves. Well, actually, I'm not going to include that because all those are done on my back. And pregnant women should not lie down on their back. It cuts off the circulation to the fetus and to you and is a very dangerous position. So stay off your back, which is, again, another reason you want to sleep on your side. Include physical activity in your daily routine. Okay, exercise, movement. Movement always helps the back. 9 times out of 10, if I have a client that I've worked with over the years who comes in with back pain, just as a function of getting going again with the strength training and the flexibility techniques that I teach, the back begins to feel better. Consider complementary therapies like chiropractic, acupuncture, yoga. I would say probably the number one thing is, chiropractic, if you can find a good chiropractor who specializes in working with pregnant women, and then stretching. Stretching goes a long, long, long way towards helping your body feel better and especially helping your back feel better. So those are 7 tips. I know at one point I was talking about 10 tips. Part of what I was thinking about are the exercises I wanted to add into this, but I didn't want to overdo it. So let's just review these briefly. We'll go from the bottom up. Consider complementary therapies like chiropractic and acupuncture, etc. Include physical activity in your daily routine. Try heat, cold, or massage. And don't underestimate. Ice is the miracle cure. Client after client after client that I recommend who has a nagging injury of some kind, and I've been trying to get them to put an ice pack on it. Finally, they'll try it and they'll say, "My goodness, I can't believe how much it helped." That's 100% of the time I hear that, but it takes constant reinforcement to get people to do it. So keep that in mind. We're going to flip back now and go to the previous page. Rolling along here, almost done. Stay with me, people. Stay with me. All right, we're going from the bottom up. So we're going to come down here. We're going to hit clearly back into the clear mode so we can actually see what we're reading. Sleep on your side with a pillow between your knees. All right. Lift properly. And don't lift super heavy stuff. Use your legs. You bend over thousands and thousands of times per day. You don't even realize it. Standing upstairs in the kitchen doing the dishes. I'm in my home office now. All day long over the weekend, if I don't stop and stretch and lean back once in a while, my back and my hamstrings are so tight by the end of the day, no one wants to be near me because I'm grumpy. Ask anybody who lives with me. Lift properly. Get the right gear, okay? That might mean a support belt, but we're talking shoes, really. Get a good pair of shoes. And inside, here's something else. This is another personal thing, but I've finally gotten to the age where if I'm not stretching enough, I really feel it. And if I'm not at least part of the time wearing a supportive sandal or slipper as I'm working in the kitchen and on my feet all day, my back really starts to hurt. So consider that as well. Walking around barefoot, I know that's the hot topic, barefoot training and all this kind of stuff, but sometimes having a nice supportive shoe or sandal on really does make a huge difference. And practice good posture. You can see I think I did a pretty good job. I sat here for the entire time in pretty good posture. All right. Now, the back gets tired when you sit in good posture, especially if you're not used to it. So it's going to take some training and some practice and some reinforcement. Keep all of that in mind. The other thing is when your back starts to ache, sitting is one of the worst possible things you can do for your back, anywhere. In your car, at your computer, at your desk, anywhere. Sitting is terrible. So every so often, get up, walk around a little bit, lean back and undo. These hip flexors get really tight when you sit for long periods of time. Do a few stretches. This is something I'll tell you over the last 6 months to a year that I've really gotten myself a lot better at, and it has helped tremendously. If you're getting uncomfortable at your desk, it is time to get up and move. I don't care how much work you have to do. You're not going to get nearly as much done if you don't get up and move. This is John Ashworth, the Fitness Nomad. Thank you for tuning in. Look forward to your feedback on this one, people. Take care. Have a good weekend.